So we're going to close now, and I'm going to just welcome Dr. Fenton Howell. Fenton, many of you will know him. He has been a tobacco control advocate for all his career, pretty much. And he is now retired, but we still pull him back from time to time. He worked in the HSE for a long number of years in public health, and then he migrated into the department to work in the Tobacco and Alcohol Control Unit and to advise the Minister and the Department of Health on tobacco control policy. So Fenton is going to provide a few closing remarks. Thank you, Dr. Howell.
Thanks, Martina. Just thinking, what was it, 2012 we were here. 2013, we had a tobacco conference here, a European thing, and the HSE and the Department of Health were working together to produce the final version of Tobacco Free Ireland. And one of the things that we said on it was that we would consider strongly bringing out plain packaging. And Minister Riley was here in the March and preempted that discussion, preempted the document, and announced it here that he was going to bring out tobacco plain packaging. And I remember looking at my colleagues who were, I wasn't in the Department of Health at the time, and they were ashen-faced. He had just committed them to doing something that they didn't really think they were going to be doing. And then subsequently, on foot of that, I was invited by Tony Houlihan, our Chief Medical Officer, to come into the department and help them. And he arranged, and we won't mention the dirty word, a secondment for me, which went very well. Anyway, so we all been here before. So look, thanks to the Tobacco Free Ireland programme for inviting me here today. Some of us last met here 4 years ago, or not here, rather, in Farmley. And I suppose since then, I've retired 3 times. And I still won't go away. COVID-19 has a lot to answer for. But what's really heartening from here today is firstly that Farmley wasn't big enough to host today's conference. And secondly, I haven't a clue who many of you are. And that is wonderful. Because there was a time when I would have known every single one of you in the room. Not that I'm good at names or facial recognition, but because there were so few of us. So this is just wonderful. And I think we should take great pride in having so many people here today, so many people involved in tobacco control. The theme for this final session, it always seems impossible until it's done. Attributed to many, most recently to Nelson Mandela, but probably first coined by Pliny the Elder in Rome around 70 AD. That was before my time. And many of us have been in that place, whether it is in our personal or professional lives. Like when you think about it, somebody agreed to marry us. Some of us passed the driving test, impossible until it was done. Some of us passed that exam, got that job, won that game, whatever. And from a public health perspective, the smoking ban in 2004 immediately springs to mind. I was lucky to be actively involved, along with many others, in that. But most people outside Ireland, and indeed inside Ireland, thought we were absolutely bonkers and that it would never happen. Plain packaging was going to be unconstitutional until it wasn't, as was the same for random breath testing for alcohol. It's amazing how things fall and then it's, why weren't we doing that all along? Martina said, I've been in tobacco control in one guise or another, both nationally, internationally, with public and civil service, as well as the NGO community, for the guts of 40 years. In fact, To be exact, it's 39 years this August, when as a young, recently qualified intern in St. Vincent's Hospital just down the road, I was bleeped at 5 a.m. Things were just as bad for NCHCs then as they are now. To recite a drip for a patient who was due for surgery that morning to have his below-knee amputation converted to an above-knee amputation. Lucky guy. My abiding memory of that morning is that there were 6 middle-aged men in the vascular ward, and they had only 4 full legs between them. And at that hour of the morning, there were cigarette butts under all of their beds. It was 1983, different times, different times. And I pondered the futility of what we were about. We had no NRT, we had no bupropion, we had no varenicline. Oops. Anyway, was that the best we could do for them? Chop another piece off their leg because their arteries were further blocked up because of their continued smoking. And I wondered, might there be something in this newfound notion that prevention might be better than cure? And there began my road to Damascus. And happily, I've never looked back. Because if it's a purpose and you could think you were doing something worthwhile. And I like to believe that those of us involved over those last 40 years have made a difference. But not enough. Not enough. And now it's your turn. Your turn to make a difference. Your turn to make sure nobody is left behind. Your turn to make the impossible possible. A tobacco-free Ireland. And today's conference, I think, is a really important step on that road. Because firstly, it has brought us all together, young and old in tobacco control, for the first time in 4 years. And it's good to say hello. I've hugged loads of people today. I thought I'd never do it again after last March 2020. How are you? Where are you working? Great presentation by X. Hadn't a clue what X was talking about. Can I give you a call? Is your email blake1 or blake2.hse? Face to a name. Oh, you're bigger than I thought in Zoom. Where did you? How did you? And all that jazz that you just can't do on Zoom, Teams, or whatever. So that's the first biggie. We're all here. Secondly, our conference was opened by Taoiseach Michael Martin, a man who has led and lived the experience of making the impossible possible with the introduction of the smoking ban in 2004, amongst other things. Don't ever underestimate the importance of the political system as we seek to achieve an endgame strategy. Some of the things we need to happen are well set out in the report, and we heard from the guys today about T21, really important. But more importantly, don't ever underestimate your ability to influence the political system to achieve the end game. And don't ever fall into the trap of saying, someone somewhere should do something about this. You are the someone. Thirdly, Paul presented the state of tobacco control in Ireland, and that gives us, in my mind, the most comprehensive comparative analysis of available data on all things tobacco control that we have ever had. And it's amazing to say that. You'd think for something that important that kills 1 in every 2 of its smokers, we would have the detailed knowledge. Well, we have now. As the late Chinese General Sun Wu said in the 5th century, again before my time, know thy enemy and know yourself. In 100 battles, you'll never be defeated. You have to know your enemy. You have to know what you have to achieve. You have to know their strengths and weaknesses. And you have to know what your strengths and weaknesses are. The report, as I said, which is full of the most interesting data analysis, sets out clearly that we won't achieve the target we set for ourselves in 2013 to have less than 5% of the population smoking by 2025. Was that target too ambitious? Not realistic? Even naive? All views welcome, and you can tell me later. However, I'm happy to take responsibility, full responsibility actually, without apology, for ensuring that that 5% goal was in that strategy document. It helped focus a mindset, and it is a statement of intent. What we want is a tobacco-free Ireland, not a reduction in smoking by X%. There is no resiling from that intent, and there can be no resiling from that intent. No one said it was ever going to be easy. As our good friend Samuel Beckett said, in my time, ever tried, ever failed, no matter. Try again, fail better. But that's for you. That's your job now. The State of Tobacco Control report has also set the scene for some of the key areas that need our undivided attention over the next few years. And key amongst them, and all-encompassing really, is the phrase, nobody left behind. And it's well exemplified in pages 10 and 85 of the report, which says, the causes of and solutions to health inequalities are multiple and complex. However, over half of the health gap across society is due to smoking. Now, that's worth repeating. Over half the health gap across society is due to smoking. Now, I'm not intending to be unnecessarily critical. Many of us in tobacco control, including the authors, have been known this for an age, and the issue has been well dealt with within the tobacco control community. But how come this message is not screaming out at us from the many, many reports, working papers, committees, working groups, NGOs, etc., that purport to deal with health inequalities in our communities? Why are we saying that to them and they're not saying it to us? Why the apparent silence? It's mind-boggling to me. And it's not only here. Yesterday, I did a PubMed search for the phrase health equalities in the international published literature since 2000, which yielded 40,000 hits. So I refined it further to see how many such articles actually dealt with health inequalities and smoking. One might be optimistic and say, you'd expect 20,000 really to reflect the true impact of smoking on health equalities. No such luck. Anyone care to guess what percentage of the 40,000 articles mention smoking as an issue? Have a guess in your own head and see where you're right. 6%. That's it, lads. It reminds me of that powerful, powerful phrase, if she can't see it, she can't be it. So we have to change the narrative. We need to change this and challenge it. We need to be much more vocal about the real health effects of tobacco use and the consequences of not funding our responses adequately, a worsening of health inequalities. As the report says, the burden of smoking in Ireland is unequal and unfair. We need to stop apologising about tobacco control. Time for everyone who cares about health inequalities to sit up, take notice, and start doing something real and tangible that will make a difference. Time for lots of people to listen and learn. And we've been here before, and we have changed the narrative. Back in 2010, I was lucky enough to be chair of the HSE's Social Market and Working Group on Tobacco. Great title, isn't it? And we were determined that the next campaign would be better than anyone before, would be evidence-based and properly funded. And off we went to a creative media company to pitch our brief. In that brief was an almost throwaway comment that 1 in every 2 smokers would be killed by their smoking. A well-known finding from the Dolan Hill study on doctors of over 40 years. This was common knowledge to all of us in tobacco control, But actually, it was a complete and absolute revelation to the creative media people and all who worked in that organisation. This to them, as they said, if true, and we needed to prove it, was gold dust, new knowledge, the very essence of any successful advertising campaign. And they were right. Pre-campaign testing showed that about 7% of the population knew this, and so began the first iteration of the HSE's multimedia award-winning Quit campaign. 1 year later, up to 50% of the population knew that 1 in every 2 smokers will be killed by tobacco-related disease. It's amazing the power of repeating a message. Every year since then, up until recently, I lectured Fort Meds in Trinity College on public health advocacy. And I asked them every time, what percentage, I'd give them a list, 1 out of 2, 1 out of 3, 1 out of 4, 1 out of 5, 1 out of 6, 7, 8, 9, 10. What proportion of people would be killed by tobacco-related diseases? And 99% of them would say 1 in every 2. And I'd ask them, and how do you know that? And they'd say, the ad campaign. At one level, you were delighted. At the other level, you were devastated, as I said to them. Did you not learn it in medical school? And they didn't. And they'd go, oh, yeah, sure, yeah. And I think that applies to all of our disciplines. So we have to, not make the mistake that because we know something, then everybody else knows it as well. It just doesn't happen that way. We need to ensure that the health inequality sector knows what their big problem is. As I said earlier, this conference has brought us together for the first time in over 4 years to deal with tobacco control, or more importantly, the Tobacco Endgame. Words matter because they impart intent, and we've got to learn to use them efficiently and effectively. All of you come from a wide and varied background. You have many and different skills. You may be new to tobacco control family, or have been here for a while, or just popped in for the listen to see what was going on. What you have heard here today is that to be effective, tobacco controls needs to be evidence-based and comprehensive. It needs to listen and learn. The public want it. There is no silver bullet, no magic wand. There never was. Each and every one of you has an important role to play, whether you're in public health, environmental health, health promotion, comms, the civil service, smoking cessation, mental health, young or old, managerial or admin, governmental or NGOs, community-based, whatever. As is always the case, success comes when everybody buys into the big picture, and is well exemplified by what happened in 1962, when President John F. Kennedy visited NASA for the first time. And in the course of his visit, he asked the janitor who was sweeping the floor what he did for NASA, and the janitor replied, "I'm helping put a man on the moon." That janitor understood the true purpose of his work. All of us can decide the true purpose of our work, or the true intent of it. Is it to see X number of smokers for counselling, do X test purchases this year, have a new ad campaign that increases social media hits, get tobacco control legislation passed, or to meet the KPIs set down in the Tobacco-Free Ireland programme implementation plan? Or is it the further the end game to achieve a tobacco-free Ireland? You decide for you what that goal is. Coming back to the title of this session, it always seems impossible until it is done. For me, tobacco-free Ireland is not impossible. It never was. It's just a question of time. Importantly, though, your individual effort matters. You individually and collectively will determine how soon that time is, when it will be done, when the so-called impossible was made impossible. When you leave here this evening, you hold the baton now. And I look forward to celebrating your success in the very near future. Thank you.
Thanks so much, Fenton, and thank you everybody for making the effort to travel and to come today. I wish you all the best and a safe journey home, and we look forward to working with you. We will put all of the slides on our TFI webpage. We will be communicating with you. We'll send you an evaluation. We're going to do it on web so that we don't have all the admin of typing. And yeah, we'll connect with everybody on email. Fergal is taking some videos, so if anybody is available, we'd like to get your impression of the conference today, and so if anybody would like to go down to the right and speak to the camera for a few minutes, that would be fantastic. Thank you.